Okay, Dr. Jarvis and Ali Worcester, properly socially distanced, you are up. And if you're ready to make an address, please go ahead and do so.
Hi, good afternoon. I'm Dr. Jim Jarvis, the Incident Commander for Northern Light Health's response to COVID-19. And I'm happy to be joined today with Ali Worcester, the Vice President of Human Resources for Northern Light Eastern Maine Medical Center. I first want to say thank you to the members of the media. It has been wonderful that you have been able to get our message out there. It is very important that we continue to stress the same message over again because that's how we're going to combat this disease. People continue to say things like the number of cases in the state of Maine remain low, and maybe that we don't need to do the social distancing that we have been practicing, and that is blatantly false. It is because we are doing the social distancing that we continue to do to keep our numbers low. It is very important for us to practice that good behavior of staying at least 6 feet away from individuals when we have to be out or about, and then honoring the governor's recommendation and requirements to stay at home when we don't have any essential travel, such as going to get groceries or visiting our healthcare providers. Also, equally important that we practice good social hand washing and cough etiquette, meaning that we wash our hands frequently, particularly after touching surfaces that others might have touched, such as a table, laptop, countertop, doorknob, keyboard, phone. And if we don't have the ability to wash our hands, that we use hand sanitizer. We should be cleaning those same surfaces with sanitizing wipes if at all possible, or at least with soap and water. And then if we do cough or sneeze, making sure that we cough or sneeze either into a tissue and immediately throw it away or into the crux of our elbow. And I know we've said this thing over and over and over again, but we just need to live this every single day in order to help prevent the spread. It is imperative that we keep our numbers low in the state of Maine because we do have limited resources and we want to protect those. And the number one resource is us, Mainers. We need to protect ourselves. So thank you. And with that, we'll open it up to questions.
Okay, and first up on the list for questions, we're going to go to Brian Sullivan at WABI TV5. Brian, and if you could ask again who your question, if you could start by letting us know who you want to direct your question to, if it's Dr. Jarvis, anything related to medical response, or if you have an employee-related question, if you could just say at the beginning that it would be for Ali Worcester, that will help our technical person on the other end make sure they've got the camera pointed in the right direction.
I'll ask Dr. Jarvis.
Hi, Brian, how are you?
Good, doctor. As you mentioned, it's to try and flatten the curve and mitigate the spread as people start to head out this weekend and they return to their homes after interacting with others or at the grocery store, for instance. What would you recommend they do when they do return to their home? Is there a procedure that you think people should follow before they go back into their houses?
So I don't think there's any special procedures anybody needs to take. I will say that the best thing to do is to come home and wash your hands again because you've been out in the community. I know that there are people who are concerned, particularly after they go grocery shopping, that their groceries themselves can spread the infection. Right now, we have no evidence that food is a source for spreading the infection. And so normal, good hygiene that we do for our food products is important. So if you have fruits and vegetables, making sure that you're washing them off with water like you would at any other given time. If you have concerns about the packages themselves, simply wiping them off with a cloth and then disposing of that cloth or washing that cloth is appropriate and will take care of most of what we see out there in the community. Really, community spread is from person to person. And so that's where the concern is. But protecting your environment is important. I will say that for healthcare workers who may be in contact with individuals who are positive for COVID-19, they may want to take some more efforts than that, meaning that the clothes that they wear at work, they may want to change out of those before leaving work so that they're wearing other clothes home and taking good care and protection of themselves. But really, it's just common sense.
And when it comes to masks, your personal recommendation as to what people should or shouldn't be doing when you go out, or will you be wearing a mask if you will go into a grocery store this weekend?
So that's a very good question. I will tell you that I went grocery shopping yesterday and I did not wear a mask while I was out, but I did practice good social distancing. And I will say I was very pleased with the staff at the local Hannafords that I happened to go to, as they were very well coordinated, limiting the number of people into the establishment, and then reminding people to stay 6 feet away from each other. Most people complied with that without any aggravation or whatever, and that's the most important thing. I will say that if it makes you feel more comfortable to wear a mask, I think that that's okay. I will say that the reason why you're hearing now, particularly at the government level, about possibly requiring or asking people to mask is really to help people remember to keep their hands away from their face while they're out in the community, and also to remind them to practice good social distancing. We hope that this is a cue to other individuals that, hey, we really do need to stay at least 6 feet apart from one another. My fear about masking is that people will then get that false sense of security that this is protecting them so they don't have to do those other things, and is those other things that are far more important to prevent the spread of this disease than masking.
Okay, next up, we are going to go to Joe Lawler with Portland Press Herald. Just give me a second, Joe, to find you in my drop-down list here. I did see your name.
If I could also add to Dr. Jarvis's answer about the masks, we do want to remind people that we need to prioritize the masks for our healthcare workers to keep them safe, particularly the N95s. The hospitals need those in order to allow our staff members to take care of patients. So those should be prioritized to the healthcare settings and not to the community spread.
Very good, thank you. And next we'll go to Joe Lawler with Portland Press Herald. Joe, why don't you ask your questions?
Hi, thanks for taking my questions. Dr. Jarvis, I was just wondering, there was a New York Times article about some hospitals running into shortages of certain medications like antibiotics or antivirals, asthma, maybe some sedatives. And even if you're not having these supply issues now, are you having any trouble ordering them? And do you see on the horizon any issues with supplies of those medications?
So currently Northern Light Health, and that's the only organization that I can answer for, has an adequate supply of both medications to treat individuals who have COVID-19. And again, those would be more supportive than curative, as well as the general population of patients that we see day in and day out, even when we're not in a pandemic. We continue to monitor the supply chain for not just pharmaceuticals, but all of our resources, and continue to work with our supply chain to make sure that we maintain an adequate supply. And right now we feel confident and comfortable that we have that.
So my follow-up is just, so you're not having any issues with ordering of these supplies for future use? The ordering has been okay?
Yes, our current supply chain for our pharmaceuticals has been stable for us. I will say that we certainly share the same concerns others in the United States do, that what if they can't get these products, or if they're diverted to hotspots, what would that mean for us in rural Maine? So that is something that we check on a regular basis and continue to adjust as we need to. But right now we feel that our supplies, at least for pharmaceuticals, are adequate, and that our supply chain will be working for us.
All right, very good. Next up, we have Erin Rhoda with the Bangor Daily News. Erin?
Hi, yes, thank you. How has EMMC changed its staffing levels? And this might be a question for Allie. How has the hospital changed its staffing levels at outpatient offices that perform more elective procedures that can be delayed, such as physical therapy, dermatology, urology? Have you furloughed workers? And if so, how many? And do they retain their pay or have to file for unemployment? How is all of that working?
Sure, that's a great question. In accordance with the advice that's at a national level, in terms of electives, we have tried to limit the number of electives that we're providing to stop people from coming into our medical facilities when there's really not a need to do it emergently. We have looked to repurpose and cross-train our staff pretty extensively because we're trying to prepare for the eventuality that we may need them to do things that they don't typically do. We've been able to work with our staff pretty effectively up till this point to make sure that they are put in a position where there's productive work for them, and that if we can train them, we're in the process of training them. We've been fortunate that we haven't had to look at the option of furloughs or layoffs at this point. We do want to keep our staff productively employed and working and getting ready to care for the patients that we think are coming. We do know that there's a lot of benefits that have been talked about at the federal level, but we're hopeful that at this point we'll continue to make good use of our staff and maintain them.
Okay, Aaron, do you have a follow-up? Oh, I'm sorry, Aaron. Let me unmute you. Don't know why the button's, there you go.
There
Aaron,
you
you
go.
should be,
Okay,
yep.
thanks.
Don't we love electronics right now?
All right, so this is a question for Dr. Jarvis. How many staff and how many workers have tested positive for COVID-19 as of today?
So we typically do not share information like that. I will tell you that the numbers here at EMMC have been very low. Across the Northern Light Health System, we have had a number of individuals who have been employees who have tested positive, but overall our numbers are low compared to what we're seeing in other areas. We're talking numbers less than 10.
Okay, next up on the list, I have Dana Rosengard with New Center, Maine. It looks like your mic is now unmuted. Dana, go right ahead.
Yes, thank you very much, Chris, and good afternoon, everybody. I believe my first question is more likely for Ms. Worcester. Hi, Allie, we've not met. I'm Dana.
Hi, nice to meet you.
Nice to meet you too. So I know that there are traveling doctors who regularly rotate in and out of hospitals and medical offices here in Penobscot County and other parts of rural Maine. My question is, what are their quarantined requirements, and how do or are they not putting local and area patients at risk?
That's a great question. We do have a number of traveling doctors, and we also have a number of traveling nurses that we rely on to supplement our workforce. But we are acutely aware that nationally there are places that are much hotter in terms of contagion and the spread of COVID than it is locally. We've worked very closely with our work health partners, and that's our occupational health group here within Northern Light, to evaluate anyone coming in as either a traveling doctor or a traveling nurse, to screen them to see if there's any risk factors, and work with them to determine advice on whether and if a quarantine is appropriate given where they're coming from and what they may have for symptoms. That remains a topic of conversation that we revisit on a regular basis, depending on what we're seeing nationally.
Okay, thank you so much. And my next question is probably best for Dr. Jarvis. Good afternoon, sir. Nice to see you.
Nice seeing you too.
My question is, tell me what you are worried about as this pandemic rolls along.
That's interesting with my role as coordinating the clinical care across our 10 hospitals. For me, I worry about the safety of our population. I live here, my family lives here, and so my concern is if we do not all do the proper things that we need to do to limit the spread of this disease, that it will hit home, and it has hit home. And so I think that's my first and foremost responsibility. And in fact, yesterday at a meeting, expressed that quite loudly, that it is my job to protect everyone and protect as many patients as possible. And sometimes that's about making hard decisions. I hope that we won't have to make those hard decisions, but my fear is that we will overwhelm our resources, whether that's at the local level, the state level, or across our country, and that people will suffer and unfortunately die because of lack of resources and not because of lack of caring, training, or any other factor.
Okay, next up, we're going to move on to Fox ABC. I know that they had a little trouble with audio before, so let me see if I can unmute him and if he can ask a question. Oh, there we are.
Good.
Hey, TJ?
Yes.
Okay, we can hear you fine.
All right. Thank you, Chris. Dr. Jarvis, you may have noticed that there was a real spike in the numbers of confirmed cases today. I think it was 56 more today than it was yesterday. In that likelihood may lead to the fact that we are on an upward swing. Is there any plan to create an off-site, off Eastern Maine's campus, hospital location for COVID-19 patients?
I'm glad that you asked that question because it is an important one. And so at the state level, we are having discussions about what other resources we can have aside from the normal healthcare resources that we currently have, like our hospitals, our long-term care facilities, and our business partners like our federally qualified health centers like PCHC or Penobscot Community Health Center here in Bangor. I will tell you that at the local level in Bangor, our city officials, our partners at St. Joseph's Hospital and at Penobscot Community Health Center have been wonderful to work with. We have already set up an offsite at Bass Park where we are doing both testing for COVID-19 as well as assessment of individuals with respiratory symptoms. Again, that is all by after going through our triage line or getting a referral from their own healthcare provider to go to that site. It is not a walk-up site. We continue to have discussions about what we would do if we did overwhelm our resources in terms of bed capacity at the 2 hospitals here in Bangor and where we can have expansion beyond that. We're fortunate here at Northern Light Health because we do have 10 hospitals, which means we can rely on each other for resources, including bed space and including staff and personnel and other resources, and expand out as we need to. Here at the medical center, we have already developed our surge plan depending on how the level of need that we would have. That surge plan increases, including reprioritizing certain beds within the facility and dedicating parts of the facility to COVID positive patients. So we continue to address that on a regular basis and again, work with our federal government level.
Are there local off-campus sites that have been targeted?
We have looked at some facilities and again, we do that in conjunction. That would be a decision ultimately made by the city of Bangor. And we feel that there are some suitable sites for us that we could use as a makeshift hospital or care center if we need to. And we will be having those discussions ongoing. I am reticent to name any particular place until we've had any final decisions.
Okay, there were a couple folks that jumped on a little bit late, so I'm hoping I've got this right. It looks like Leslie is from, okay, and you're from Penobscot Bay Press?
Yes.
All right, then you are up next.
Great. I have one question for Dr. Jarvis. Are you still only testing first tier, I guess you call them patients?
Yeah, tier 1 individuals because they're not all necessarily categorized as patients. And so yes, we are. And that's because we continue to have a critical need for further testing reagents and test results. And therefore we need to ration that and serve it where we think it will be the best good. And that remains to be patients who are hospitalized, and then healthcare workers and first responders, and those people living in congregate living situations such as a nursing home or a shelter or a group home. And that's the reason being for those tiers. Obviously for inpatients, it's important for us to know their status because it makes a difference in what level of personal protective equipment we use and may make a difference in how we treat those individuals. First responders and healthcare workers, we need them to be out there on the front lines doing those jobs to keep us safe and keep us healthy. And so it's important that we know whether or not they are positive in order to get them back to work if they are negative. And then lastly, again, limiting the spread in those communities where people live in close proximity. We are addressing other needs if we need to for other individuals. If we feel that it will change their care in any way, we can prioritize those individuals as well. But really, we have to stick to those tier 1 category individuals.
If I could follow up with one question. You mentioned care centers. Could you explain what those are?
So, again, we have many outpatient clinics. And so those all are facilities where care is rendered. And then we have things like long-term care facilities like nursing homes, group homes, where there are some modicum of care being provided in those places as well.
Okay, next up, sorry, caught me typing there. I believe Amy from WERU is on the call. Amy, do I have this correctly? Can you hear me? Oh. Amy? Okay, I don't hear anything from Amy, so I guess again, not sure if she's on or if she has a question. We only have about 2 minutes left or so. Is there anybody that has an important follow-up question they'd like to ask? Please let me know in the text box, and I'll try and get you. Oh, Amy is trying to. Oh, Amy.
Yes,
are you
can
there?
you hear me now?
I can hear you now, Amy.
Okay, great. Thanks. Sorry about that. At the daily briefings with the Maine CDC, Dr. Shah has given totals of the number of ICU beds in the state and ventilators in the state, and then how many are in use each day. But they are currently unable to break down how many of the ones that are in use by patients who've been diagnosed with COVID-19. Do you have numbers for that within the Northern Light Health System of how many total ICU beds and ventilators are currently being used by people with COVID-19?
So that's actually an easy answer for me. So right now we only have one patient across Northern Light that's currently in a critical care setting, and thankfully right now they are not on a ventilator. Obviously those things can change from moment to moment. We've been a little bit fortunate there. And again, I think that is not to be reassuring that means that we don't have the virus out in our community. But I think it is reassuring that we have been doing the things we need to keep that viral spread as low as possible.
Great, that's great to hear. And my next question was going to be about the number of pediatric cases that you have in the hospitals, but unless that one person's pediatric case, I'm going to.
So I'm not aware of any pediatric
Okay.
cases within the Northern Light entity where anybody has needed to be admitted to the hospital, at least not recently. And so, but I can't answer any more clear than that.
Okay, thank you.
Okay, Dr. Jarvis, I'm just going to read you. It's a quick clarifying question. I think that's going to be it for this session. But Aaron Rhoda from Bangor Daily News, I won't bother bringing you back on, but I'll read your text, Aaron. Had said that it asked, you said less than 10 people had been infected. Were you speaking about patients, staff, or both?
I was purely speaking about employees of Northern Light Health, not patients in any way. We know that their numbers are much higher than that for individual patients.
Okay. All right, I'm going to let that be the last word. I thank you all very much for your time here, and hopefully you got some use out of this media availability. Those of you who want a recording of this, could you either send me an email or just